This K Ren speaking. My original YouTube channel was Karen Cobster, which I found out was a little bit hard to pronounce when Dr. Mike answered my question about CPR, which I'm glad he did. I would have performed CPR anyhow. It's just trying to avoid any kind of potential damage that could be done. Oh God, okay. I didn't realize that. Okay. Okay, whatever. Anyway, so I do have a lot of questions that I've been trying to ask Dr. Mike. And I know that he has his own channel, and I know that he has his own practice, and there's a lot of things that he has to address in his own life. And I'm not trying to impede on his life in any way, or try to be some kind of crazy fangirl that's oh my God, Dr. Mike, I'm just trying to get actual answers to serious medical questions that I have no medical background for, despite the fact that my entire family, has been in the medical field. So, the questions that I have to ask are very serious, and they involve knowing a lot of medical knowledge that I have no means of being able to learn in the length of time that I don't have time to learn these medical things that I'm supposed to be able to learn to take care of my mother and my father. My mom is currently in the ERCC, and the ERCC is doing very well at taking care of her, but there are serious medical questions. I was presented with the medical question of, should I take my mother off her blood transfusion, or not her blood transfusions, should I take my mother off of her blood thinners, because her blood thinners are causing her to need multiple transfusions, and she's been in and out of the hospital because of these blood transfusions. But, if we take her off the blood thinners, there's an obvious factor of her having a heart attack or stroke. So, it's I'm trying to study the risk factors, and I'm trying to study all these things, but I only have access to Google, or, having to ask, a doctor in a rural area who has to deal with, multiple patients, and doesn't have, I feel like I'd be, better off with my mother living in a city where, there's more access to information, there's more access to, a lot of other things, there's more doctors, there'd be more people working with her, possibly. But, I'm kind of in a complicated place because, I'm having to deal with two parents in a medical situation, and, it's I'm having to, it's almost like a rat race trying to figure out how to address both parents, and it's also a rat race, because, it's also a rat race trying to be able to get all of this knowledge, immediately, because, with my dad, it's a little easier because he has prior knowledge, but, well, my mom has prior knowledge too, but, it's I don't want to be in a situation, let me tell you a story. My mom was in Ruby, in Morgantown. She was practically, unconscious. She was incoherent. She was literally, to the point where, it was she was speaking, but, she wasn't relaying proper information. she'd point at something and say ODO or numbers or like variant of letters. And I just got to Morgantown, and my sister, was dealing with this like a week before I got there. And this doctor comes in, and he was nervous because he just literally started in this facility. And the first thing that happened was he walks in, he's like, we may need to amputate her foot. And and Caitlin's freaking out, my sister. And I'm like, is this the first time you're hearing this information? What is going on? And like, the plot thickens from there, because basically he wasn't able to adapt to the system that was in place for like relaying emails from like doctor to like specialist to specialist, or like person to person. So it got kind of dicey, and the hospital like did an MRI on the wrong foot, and then it got to the point where she was moved up from like one area to like a higher level, because eventually they were able to figure out that there was something legitimately serious going on. And I'm sitting here trying to talk to the nephrologist. I'm trying to talk to multiple people. She has multiple conditions and multiple areas of like the spectrum of medicine, nephrology. She had a wound in her foot that needed taken care of. It had infection in it. They use these like antibiotic beads, but there are numerous things, and I'm like sitting here trying to like get the information from multiple specialists, and it's like I'm like trying to really like write it down, look it up, go back and talk to them. I'm trying to literally like run around like a rat race, like trying to figure out stuff. And then in the meanwhile, it's like I'm like trying to write down information. Next thing you know, I feel like an infant, because I'm trying to like write down this information. They already know it, so they're speaking quickly. Because obviously they have other patients. They have other things to address, and it's like I'm like kind of tired of being redundant and asking like the same questions. And I was diagnosed with ADD in college, so maybe that's why like people are bringing up these extravagant medical terms, and I'm like not able to relay get the information or relay the information correctly. And honestly, it's like my lack of knowledge is stunting their care, and I don't know what to do about that. It's like I've tried to look up cited resources. There is one medical book, Mercer, I think, was the publisher, possibly. I don't know. I just need to amp